want to thank all of you for coming to my channel. And today, I think this is the first time I am talking about this topic. And I hope that you all can learn. And before I go further, I want to introduce myself. I'm a consultant cardiologist. I'm the ex-president of Malaysia Healthy Aging Society. My topic today is on loneliness. So you may suspect that I'm a loneliness consultant. No, I'm not a loneliness consultant. And this is a topic of interest to me. And I'm presenting, whatever that I present is based on evidence and also research. And this topic today, I'm not promoting any of my services. It's more of increasing awareness that's important for healthy aging. So I want to share with you is that loneliness is a risk factor that all of us must be aware of. So we are aware of cardiovascular risk factors like hypertension, diabetes, and all that. But loneliness is a very important risk factor. It's an important trigger that tells us to seek for company. Just like when we are thirsty, we will have to seek for a drink. And when we are hungry, we have to look for something to eat. So these are some of the comments that is taken out from this Older Man at the Margins project. These people say that loneliness is an emptiness, being in a bottomless pit that's empty. And loneliness to me means I'm entirely on my own. Nobody is with me. I feel that there is nobody around me, nobody sitting with me, and there's nobody to talk to me. I feel discarded. I feel left by human society and things like that. That's my feeling, and that's how I feel. And in June 2016, there's a loneliness survey. So I want to ask the audience here, any of you had this feeling? First one is a feeling ignored or invisible most of the days. You have not had any conversation with friends or family for a month. You have not had any conversation with your friends or family for over a week. You feel that you have been cut off from the society, and you are often or always feel lonely. So if your patient or any of you have this type of feeling, then you qualify for some of the criteria in the survey. So this survey found that in UK, those who are more than 65, 16.1% of them has often feel ignored. 1.7%, about 200,000 people, have not had a conversation with family or friends for a month, and 360,000 older people have not had a conversation with friends or family for over a week. And 12.1% of them felt that they have been cut off from the society. And 8.5% of them felt that they are often or always feel lonely. So I urge healthcare professionals should look for these new risk factors. What is the problem of this risk factor of loneliness? So in Healthy Aging Society, we have 5 pillars of happiness and good quality of life: health, financial independence, and social interaction, and freedom of time. So these are very important pillars, and today I'm focusing on the social interaction. And in many blue zones in the world, they have done studies and found that those who are well connected, they can live very long. And this is a better indicator of longevity compared to smoking, obesity, and lack of exercise. So if you are well connected, you can have some of these bad risk factors. So social connectedness are very important. And for those of you who have listened to my talk before, there's a big circle around these 4 pillars, which is higher functioning, spiritual, and also contribution to the society that can overcome these 4 pillars. If there's opportunity, we can talk about it in future. But today I'm going to focus on the social interaction. So those of you who has done geriatric posting, you may remember this geriatric giants. In 1965, Professor Bernard Isaacs coined the term geriatric giants, which is immobility. These are for older people. Instability, so risk of fall, incontinence, and dementia. But I think isolation or loneliness is the new giant, and not many people are aware of it. So practitioners are encouraged to be vigilant and screening for the risk factors like smoking, alcohol use, and physical activity, and to prevent further disability, hospitalization, and mortality. And loneliness is one of these factors that is important. So what's the prevalence? So in UK, they found that there's a U-shaped curve. Even young people felt, they've been surveyed and found that 80% of them felt lonely. And the older population, 40% of them who are more than 65 years old report being lonely at least sometimes. 15 and 30% of the general population, loneliness is a chronic state. In UK, 3 out of GP says that they see between 1 and 5 people a day who have come in mainly because they are lonely. Because they are lonely, they are worried and they need someone to talk to, they come to see their GP. And despite being in the company of others, older adults living in the residential and long-term care in the nursing home experience high level of loneliness and isolation. So they are physically in the presence of many other residents, but they felt lonely. As many as 44% of seniors living in the long-term care in Canada has been diagnosed with depression or have symptoms of depression. And these residents are more likely to be socially isolated. So it's a common problem. But a lot of us knows there's such a problem, but we have no solution. Okay, now I'm going to present the statistics for different countries. And in US, the data is more robust, and it shows that 1 in 5 adults are regularly or often feel lonely. On average, people have 5 close friends. And who are lonely? Men more than the women, and millennials more than the Generation X, boomers and elders. Singles are more lonely than the married, and the lower economic status are more lonely. And in Singapore, you can see here that that those who are in single household, single person household, they are getting higher and higher. So you can see that more person living on their own in Singapore. And in UK, these are statistics from UK, it shows that those are the things that we discussed earlier, feeling ignored and all that. These are data, the same data. Okay, so I want to ask all of you here, if you are in trouble, how many people can you depend on? So in trouble means that if you are health in trouble, like let's say you are sick, or if you are in financial problem, how many people can you depend on? So you spend another 2 seconds to think about it. Who are the people in your mind that you can recruit or your resources to help you? So this is a study that showed that that 15% of the respondents says that there's no one that they can depend on. 32% say they only 1 or 2%, and 53% have this number of people. So if you have no one that you can depend on, then you are at risk of a loneliness problem. So this is of interest for those who are not married, and it shows that those who are married, they are less likely to be lonely. If you're widowed, the risk is increasing. When you're divorced and separated, and you are never married, these are high risk for loneliness. So being married is a good prevention for loneliness. So it doesn't mean that if you diagnose your patient has this problem, you ask them to get married. But just as the statistics shows that if you are married, you are less likely to be lonely. Okay, so next I want to define the term that you can see on when you look at the literature. So loneliness is defined as a distressing feeling that accompanies the perception that one's social needs are not being met by the quantity or especially the quality of one's social relationship. So quantity means that you can meet, but it may not be a good quality relationship. Social isolation is commonly defined as having a low quality and quantity of contact with others. It is objective and can be measured using observation of an individual's social network. So it's objective that you can see. But loneliness is a feeling of isolation, regardless of the objective social network, and loneliness is often viewed as a subjective counterpart of social isolation. So what does it mean? So objective means that you can see that the person is surrounded by many different people. They can live in a nursing home, but they might be lonely because of the subjective feeling of being isolated. So social isolation is very similar to physical isolation. So the differentiation of physical distancing and social distancing. So during the MCO, we keep talking about social distancing. I think that's a wrong term. During the MCO, it should be physical distancing. We should not be doing this social distancing. Social distancing means that you are emotionally distanced from others. So physical distancing is important, but not social distancing. So people can live relatively solitary lives and not feel lonely. Some people can live alone, but they are not feeling lonely. And on the other hand, they can live a very rich social life. They can have a Facebook friend, or they can go out and meet many people, but they may feel lonely inside. So these are the terms that you have to be aware of the physical loneliness or the emotional loneliness. And loneliness is described the pain of being alone. But if you are solitude, some people choose to be alone, and this solitude means that it's a joy of being alone. So loneliness is a pain, but solitude is a joy of being alone. Some people who are spiritual, they are developing their spiritual attainment. They prefer to be alone, and it's a joy. So we have to be careful when we look at some of our friends or patients. Some of them choose to be alone. So these are some of the terms that I discussed earlier: social loneliness, emotional loneliness, existential loneliness. Okay, this is very important. So you could be talking to others, and also you could be living in the environment with many people, but you feel that nobody would care that you were here or not. So you can be here, or if you are gone, nobody will notice. So this is a kind of loneliness that is very important for the deep down patient's happiness. So when we talk about quality of contact, so it could be quantity, so we can have a lot of contact, but more important is the quality. So with the contact, the quality will determine the emotional loneliness. So you must form a meaningful connection, and the meaningful connection is reciprocal and mutually rewarding. So both sides are happy with this interaction. So what is a good quality of contact? So these are the things that you can advise your patient. Physical contact using all the senses like visual, auditory, touch, and smell and taste. So for non-family, maybe having the activities together, like eating together, using all your senses. So these are some of the things that can be considered as a quality contact. Emotional sharing of empathy, joy, sadness, anger, frustration, insecurity, worry, and others. So just by verbalizing it is a deep connection. And non-superficial conversation. So what it means is that when you meet someone that you don't talk about the weather, you don't talk about the economy, or you don't talk about politics. You talk more in depth in terms of their personal emotional and all that. For actively listening to their needs and problem solving. So what it means is that when you talk to someone, you listen to their needs. What are their problems? And you actively wants to help them to solve their problem. So to relieve their suffering. So that will be considered as quality of contact. And sharing of activities like sports and shopping or anything, that is also considered quality. So some of us, all of us will have a period of time where we feel lonely, but it could be a normal loneliness. So what does it mean? It's a transient feelings of loneliness. It could be minutes, hours, or occasionally days, experienced by most people and are often relatively mild. So that's normal. These transient feelings of loneliness can have aversive consequences, but these tend to be adaptive. So is to motivate us to reconnect. So if there's no such signals, so in our biological system, we always have signals and the feedback loop. So whenever we have some pain, so this pain is a pain of sadness, anxiety, and worry that will trigger us to reconnect. And typically, it is quick to dissipate upon re-establishment of the sense of connectedness. And transient loneliness may also have immediate or brief physiological effects. This kind of stress can have some cortical response and also may have also long-lasting consequences on our health and functioning. So it's normal to feel lonely as long as these signals are acted upon. Okay, so if you're a healthcare professional, so how can you identify loneliness? There's a few ways that you can do it. Here, there's a single item screening question that you can use. I think this is the simplest. You can ask them, how often do you feel lonely? So you say hardly ever or never, some of the time. So these are good screening questions. And if they say hardly ever, so I think they should be okay. If they say they're often, then you may ask further probing questions. And the 3-item loneliness scale, which you can Google and find out. How often do you feel that you lack companionship? And how often do you feel left out? And how often do you feel that you're isolated from others? So this is making the diagnosis, is not providing the solution. Solution, I will present it later, but very similar to what I've said earlier. You have to have a deep interaction where the interaction is non-superficial. So as a GP, family physicians have trouble identifying their lonely patient because of lack of awareness. And a Dutch study here showed that while family doctors acknowledge the importance of patient feeling of loneliness in their daily practice, they have difficulty responding to these feelings and face a lack of therapeutic options. So even if you know that there are some problem, but we have no way to help them. And family physician and other primary care providers might be the only point of social contact for many older patients. This is more in the Western country. Like in UK, the patient are linked to their GPs. And it has been suggested that just as physicians screen for risk factors such as smoking, diet, and exercise, we must identify patients who are isolated, lonely, or socially vulnerable and recommend evidence-based intervention that could strengthen their social connection. So, so we must be aware and identify this group of patients. So what are the barriers for GP? Because we lack the necessary consultation skills or confidence to deal with loneliness and limited time. So if you have a 5 to 10 minutes consultation, very difficult to explore this problem of loneliness. Lack of resources, even if you identify what can you do, if the country doesn't have the support system, it's very difficult. Maybe you have to get to know some NGO that can provide this help. Therapeutic nihilism means a normal response to difficult circumstances, illness, or life events. So you can say this part of aging, part of life transition changes. dissatisfaction with the type of treatment that can be offered, psychological or social intervention. So you may think that some of this doesn't work. Okay, so what is a cause of loneliness? So I'm using the model of a disease where we look for cause, complication, the mechanism, and the management and diagnosis. So what are the risks? First one, social demographic, medical risk factors, and social risk factors. So social demographic means that if you are older, you have higher chance. If you are poor, loneliness is a big problem. And living in a long-term care, living in the kampong, rural areas where you are less contact with others, and living in the city area, but in the low-income area. So money, financial independence are very important. Medical risk factors, if you have multiple chronic disease, hearing and vision loss, when these are very important senses. When you have hearing and vision losses, it's very difficult for you to communicate with your friends and families. And the isolation will become higher and higher because of lack of communication. Cognitive impairment, if your memory is getting worse and higher functioning brain power is getting worse, difficult for you to maintain a good conversation. Functional impairment, immobility, priority, you're so tired. And social risk factors are living alone, living far from family, lack of transportation, very few friends, caregiver of an elderly relative, you have no time to interact with your friends. And life changes, transition, change of residence. So some older people who stay in their hometown, and when they come to the city to join their children, they may feel lonely because they lost the contact with their regular friends, and the children are working and lack of communication with their family, even though they are staying in the same house. Shrinking of social network, loss of spouse, declining health, and loss of license. So when you get older, you may lose your license and cannot drive. Aging and disability, and also retirement. So if you continue to work, you have contact with your colleague, and your loneliness feeling will be less. So it can happen at all stages of life, young and old. This is what we have just gone through: loss of relationship, bereavement, divorce, financial difficulties, poor mobility, and poor health, caring for parents. Your quality of local neighborhood, very important. So if you are in an area where there's a lot of crime, fear of crime, you are very scared to go out, and transport, public transport is not good, and the street layout is not safe for you to go out. And the attitude experience in the everyday life, including how people feel they are perceived by others, limited or negative outlook on life, and lack of purpose in life. So these are some of the probable risk factors for loneliness. So what are the complication of loneliness? So it affects many components of our body. It can have this altered hypothalamic thing, increased inflammation, earlier mortality. So it can affect our physical health, mental health, and health service use. So mortality. So it's been shown that loneliness is worse than obesity, and is similar to smoking 15 cigarettes a day. So it can cause cardiovascular disease, falls, or mental health. It can cause depression, dementia, and elder abuse, increased use of the ER, and visiting to the doctors, and hospital readmission, and also reduce your immune system. So these are complications, and it's proven by research. And this is another slide. So those people who are lonely, they're feeling of anxiety, increased vulnerability, and anger, feelings of sadness, depression, and worldliness, feeling of emptiness, pessimism, and resentment. And it affects their behavior, physical health, psychological health, and access to services. So what is the mechanism of this loneliness as a risk factor for disease? So our humans have evolved to survive in a difficult, hostile environment, and we are selected for social group living because of the reproductive success of the human species hinge on offspring surviving to the reproductive age. So social connection with a mate, a family, and a tribe fosters behaviors of cooperation, and enhance the likelihood of survival to the older age. So loneliness is a basic needs trigger signal, similar to pain, hunger, and thirst. So loneliness means something is wrong. The pain of social disconnection for security and the survival of our genes. And the model here shows that if you are perceived that you are socially been isolated, it's a feeling of unsafe. And unconscious surveillance for social threat produces a cognitive bias where the social world is a more threatening place, expected more negative social interaction, and remember, more negative social information. And this negative social expectation tend to elicit behavior from others that confirm the lonely patient's expectation, thereby setting in motion a self-fulfilling prophecy in which lonely people actively distance themselves from the other social interaction. The self-reinforcing loneliness loop is accompanied by feelings of hostility, stress, anxiety, and low self-esteem, and represent a dysfunctional positional tendency that activates the neurobiological and behavioral mechanism that contribute to adverse health outcome. So this is a model of how loneliness causing the medical problems that we mentioned earlier. Our health behaviors also change where there's a diminished capacity for self-regulation of one's thoughts, feelings, and behavior. So we have talked about the causes, the complication, and the mechanism. Now we'll go through the solutions. So there are many studies, and these are interventional studies for loneliness. And you can see here, social facilitation, psychological therapies, animal-based, physical activity, health and social care, befriending, leisure, and skill development. So I want you to pay attention that a lot of these are activity-based. These are more of a healthcare professional based, but the rest are activity-based. So you can read on your own. Some of them are effective, and some are not so effective, but you can read. But here, I take the opportunity to share a story. There's one psychiatrist, when Cambodia was first opened to outsiders, psychiatrists went to Cambodia and introducing them to some of the antidepressant. So the psychiatrists in Cambodia, it's the first time they meet up with Western medicine. So when they got to know that there's an antidepressant drug that can treat depression, the Cambodian doctors say that they do not need such a drug because they have their own solution. So the psychiatrist is very surprised and asked him, what are the things that you use? So he was expecting some herbs that they use. And this Cambodian doctor said that we have a patient who was handicapped because of the landmines. So his 2 legs have been bombed, and he became very depressed because he become handicapped and he cannot earn his living. So the psychiatrist met up with the community leaders, and discussed and decided to give him a cow. So the reason why they give him a cow, because this cow will provide milk and he can earn a living out of the cow. And the psychiatrist say that our treatment for this depressed patient is giving him a cow. So, and true enough, after a few months, all his depressive symptoms all disappear because the cows have provided a solution to his problem. So it doesn't mean that all depressed patients will give them a cow. So and the lesson from this is that whenever there's any of this psychiatric problem, majority of depression, anxiety is because of lack of if you trace to the source, it's because of loneliness. There's no good quality interaction with your family or friends and the support system. And in the West, they are now piloting many programs where they, instead of using drugs, and sometimes it doesn't work, they get some of this patient with depression or anxiety to meet up regularly and And the function of this group is to discuss and do activities together. So they may have a community garden, and they may also have activities together. And when they have good interaction with each other, they support each other and also try to solve each other's problem. And it seems to be working better than the drugs that's used for antidepressant. So these are something that you can find out from the public domain, and it's not difficult to find. And whenever you see patient with loneliness, you can use this structure. So first, okay, this structure can be used for any patient. It's not just for loneliness. You explore and ask them what is happening now. Facilitate the person's telling of his or her story and review the degree of loneliness or social isolation. How bad was it? Who come and visit you? So it's just a curiosity process where you explore. Second thing is that you explore for solution and goals. What are their resources? What solutions are there? Help the person imagine a different future. How would you like the things to be? What would you be doing differently? What are your interests, your strengths? Have the individual set his or her own goals. So your job is not to provide solution. You're just asking questions. So you just ask the right questions. And then once you ask the right questions, then we sit down and decide on the action. So what needs to be done, and helps the person construct a plan that maps out where or he wants to get to. Start with the smallest action first. So you don't start with a big action. You must go out to meet 10 people and talk. Start with a small little action, and usually it's activity based. And your job as a doctor is not to provide the solution. It's just to make him aware that they can do certain things.
Good afternoon, ladies and gentlemen. Have your attention, please?
Okay.
We are testing the fire alarm system.
There's alarm system here, sorry. And social prescribing. So widely adopted and promoted in the UK and been studied in communities in Ontario. In this model, a patient is identified within primary care and referred to a navigator who assess their needs and connects them to appropriate services. So you can caregiver their spike, sensory services, recreations, transportation, food or income supports. There's 4 main types of intervention. You enhance their social skill, teach them how to talk instead of being the habitual negative communication. You teach them not to focus on the negative. Providing social support, increasing opportunities for social interaction and addressing maladaptive social connection. A neighborhood approach. So making loneliness everyone's business in every community. Place-based approach to loneliness, anyone of any age, making every connection and conversation count. Diverse communities are more at risk. Reduce the stigma. It's normal to feel lonely. Give people a reason to connect and stay connected. Prioritizing time to connect and be with others. So some of the practice that you can tell your patient is that at least talk to someone a day, every day. Instead of not talking to others. So you can go out and buy things instead of ordering things from the Grab. So interact with people, and let's say you go to the hawker, you can ask them about their family and about their business, other than just paying and buying their foods. Okay, is this in UK? They have this campaign to overcome loneliness, and there's structural and enablers, direct interventions, gate services, and also foundation services. So they provide transport for them to go for activities. They provide technology for them to interact with each other, and then they go for transport and some of these activities and getting the people to go out. Okay, so I think I have finished my presentation now. If you have any questions, maybe I can try to address it. So thank you for listening to my talk. And if there's no question from the audience, maybe I will just want to remind all of you that loneliness is a big problem. And in many of the blue zones longevity studies found that the key for their longevity is social interaction. The social interaction is a good quality interaction where you are very confident that you can get someone to help you and support you when you are in trouble, when you have health problem. So sometimes you see some of these elderly coming to hospital. If their children are not around, their siblings or their good friends will accompany them. So we must always form a good relationship and create good affinity with everyone that you meet. It could be your family, relatives, or friends. And once you are aware of your patient having this problem, you have to make them aware. Sometimes they are not aware that their depression is because of the lack of quality relationship with others. So instead of uh, asking them to exercise, to eat healthily, you should encourage them to interact with others and form better relationship. And the way they talk also is important. If they use strong words or negative comments, sometimes will create a problem for themselves. I think with that, I thank all of you for listening, and hopefully you can learn something. So don't refer your loneliness patient to me because I don't see loneliness patient. And all of you would have a patient who are lonely, which you have to try to help them as much as you can. Okay, with that, I thank all of your attention, and hopefully you can learn something. And in future, I will invite some other expert to come to this channel um, uh, to talk about some of the important issue that's important for all of us. Okay, thank you.